see that Isabel has started the recording. So good morning. This is Commissioner Dave Yamamoto. Today is Tuesday, January 25th, 2022, and we'll call this meeting to order at 8 a.m. Appreciate everyone for being here. Before we get started, I'd like to remind everyone to please mute your phones. You can do this by pressing *6. Please unmute yourself when called to speak. Again, pressing *6. It's very important for all others to remain muted. Thank you so much. So let's start with the commissioner's roll call. Commissioner Scar.
Good morning, I'm here.
Good morning. And Commissioner Bell.
Good morning, I'm here also.
Good morning. How are you this morning?
Getting better, thank you.
We did invite our newest state senator, Senator Rachel Armitage, and we were waiting for her to be sworn in, and I believe she was sworn in late last week. I just reached out to her yesterday afternoon and didn't hear anything back, but I would like just to ask to make sure that Senator Armitage, are you with us this morning? And so apparently not, and I'm sorry. I will continue to reach out to her and make sure she knows about this meeting, and she does have some call-in information from us. But hopefully next week she'll be here, and we would love to welcome Senator Armitage to this morning call. So let's just start right off, and we're going to go to Adventist Health and Eric Swanson. Eric, are you with us this morning?
I am. Good morning, Commissioner.
Good
13
morning.
patients in the hospital today with one brand new baby. We have less than 3 COVID patients admitted. There's no patients boarding in the emergency department. There are 8 surgery cases scheduled today. All of them are elective or non-urgent. Yesterday we had 11 911 transports, no transfers, and 1 transport home from the hospital. The number of hospitalized patients with COVID across Oregon is 1,045, 19 more than yesterday. There are 161 COVID-19 patients in intensive care unit beds, which is 2 more than yesterday. 76 of those patients are on ventilators. There's 848 ventilators available across Oregon. There are 48 available adult ICU beds out of 643 total for the state. That's 7% availability. In Region 1, we have 19 available, which is 6% availability. And there's 243 available adult non-ICU beds out of 4,096 for the state. That's 6% availability. In the region, we have 71 available today, which is 4% availability. Taking a look at the January 20th OHSU COVID forecast that comes from Dr. Peter Graven, we have, again, this morning, 1,045 hospitalized COVID-19 patients across Oregon. All regions in Oregon are showing a rapid increase in hospitalized patients. As of January 18th, 25% of occupied ICU beds are filled with COVID patients, and cases are remaining high over the last 2 weeks. Pediatric patients, we haven't talked much about pediatric patients with COVID, but the current census for pediatric patients in Oregon that are confirmed positive, under 18 and hospitalized is 23 on January 18th. So Oregon's pediatric census rate is 2.21 per 100,000 in population of children, those under 18. But other states have much higher rates, up to 7 times higher than Oregon. So we're blessed again here in Oregon that we don't have that many hospitalized pediatric patients with COVID. So his forecast, which is the one that I'm watching for hospitalization, is he projects that we're going to peak for hospitalization on February 1, and he's projecting 1,553 hospitalized patients with COVID. And as I reported earlier, there's 1,045 currently hospitalized, so that means we're going to need 500 more hospital beds if we get to his projection. And the hospital bed situation is already pretty dire, and that's going to make it worse if that projection holds. So he will be reporting again later this week, so we'll just keep watching that projection. So I'm open for any questions. That's all I've got for you this morning.
Thank you, Eric. Do we have any questions for Mr. Swanson? So, Eric, just a prognostication. I know we've got a lot of patients. Maybe the seriousness of those that are contracting COVID are not as bad as the Delta variant. How do you look into the future, into February? Is this going to fall just as rapidly as it rose? Or, I mean, I know I'm asking an impossible question of you, but I just like your thoughts on that.
So I think that's a really important question. And what I'm looking at here is I've got Peter Graven's report open in front of me. And by the way, it's publicly available on OHSU's website. And one of the things that he reports is that in states where they had early Omicron, it was just like you described, that it peaks rapidly and declines rapidly. And this is one of his quotes, that the early Omicron states have already peaked for both ICU and hospital inpatients, and they're seeing decline in these other states already. So I think that based on that data, that it rises quickly and declines quickly, and there's less hospitalization as a result of Omicron. We have to just remember that there's still Delta variants and other variants out there, but what we're seeing is a lot of Omicron is what I'm being told.
Thank you, Eric, for weighing in on that. I know that was unfair of me to ask, but our audience, I think, really does want to know these things. So I do appreciate your thoughts on that very much. I do.
Yeah.
Do we have any other questions for Eric? Oh, I'm sorry. Go ahead.
It's difficult, and we want to know, how do we project what's going to happen next? I mean, we want to know internally so we can, make plans as best we can. So we watch the data every single day. Can I cover one more thing with you?
Oh, please do.
So one of the things that we've been working on is resolving some of our telephone answering issues. We see anywhere from 500 to 1,000 phone calls a day on two phone lines, 842-4444 and 842-5546, which is our main clinic number. And we implemented some changes a couple of weeks ago, and we're really watching the data every day, trying to reduce call wait times, the number of abandoned calls, and how long a telephone call taker is on the phone with anyone. And we are seeing some improvements. We're not where we want to be yet, but data for Friday, for example, we had the lowest call wait time that we've had in the last 2 weeks, which was 54 seconds. Our goal is to have a call wait time of about 20 seconds. On Friday, we only had about 11% of our calls abandoned, and we've had as much as 40% of our calls abandoned. So for all of our customers out there, we are definitely working on this and making changes every day to improve that part of the experience of calling in and actually having somebody answer your call. So just thought I'd share the little of that data.
I appreciate that very much, and I'm sure our listeners also appreciate that very much.
Yeah.
Any other questions for Eric? Thank you, sir. Let's move on to the Coastal Caucus. Before we start with the Coastal Caucus, I want to do one more plea, if I might. Again, we very late yesterday, we did invite our newest senator, Rachel Armitage, and I just want to know maybe if Senator Armitage is on the call this morning. We will continue to reach out to the good senator and see if we can get her scheduled on Tuesday mornings for this call. I think that would be great. So I'll turn it over to the Coastal Caucus and let you guys duke it out as to who wants to start.
Commissioner, this is Senator Anderson. Thank you, and good morning. Greetings to the Tillamook listeners.
Thank you for being
I
here.
can't help but notice and enjoy the run of sunny days we've had. It's an unofficial observation, but it sure seems to have had a positive effect on people's attitudes. I would remind our listeners that the short session starts this coming Tuesday, a week from today, and runs for 35 days. I have noticed also the closer we get to the start of the session, the volume of pre-session meetings has increased, and for members, for myself anyway, and that has comprised of lobbyists who are, concerned about bills that might affect them or bills that they're pushing, as well as fellow legislative members who have their own bills that they're advocating for. Last week, I was honored to speak at the Oregon Health Forum. I'm on a couple of work groups and task force that they were interested in. One, the Universal Health Care Task Force, and then the other, the Behavioral Health Transformation Work Group. So we spoke about those and their prognosis, as well as upcoming legislation that might affect the health industry. So things are heating up, and again, a reminder that there's a limited number of bills, thankfully, that have been proposed, and not all of them will make it through. So it'll be a quick session. So thank you.
Senator, thank you for being here. I do appreciate it very much.
Good morning,
Who's
it's
next?
Suzanne.
Representative Weber, good morning.
How are you today?
I am well, thank you. Enjoying the sunshine.
Yes, it is a blessing, isn't it?
It is.
So I wanted to let you know that I will not be here next Tuesday morning, because that session that Senator Anderson spoke of begins at 8 o'clock in the morning next Tuesday. And so I'll miss you all, because I think that this is a very valuable way to communicate with people as to what's happening in the legislature. And everything that happens there affects people in our area and in our state. And some of those things are profound, and some of them have unintended consequences. And so it's nice to be able to get to report to you on a regular basis. Senator Anderson talked about meeting with people and the volume of requests that we've had in the last few weeks. I must say that some days it's 8 hours of talking to people. And the number of bills that are being brought are limited. Right now we're only looking at 10 in education and about 10 in housing. And so it is a short amount of time, but I think that we will be able to address these things in a timely manner. And if I have concerns, or if there's information that I want from you or get to you, I will be connecting with you. Today, I get to meet with the folks from the Farm Bureau, and I'm really looking forward to that, because being able to meet with people and to be able to explore different areas. Last week, I had a 6-hour tour of the port of Astoria, and I learned a lot. They have a lot of challenges, and they also have a lot of opportunities. So, as all of our ports have up and down the coast. So, on Friday, there's also a meeting of the Salmonberry Trail, and I wanted to report to you that work on that also is continuing. And so hopefully at some point in time we'll have that trail completed so that people can enjoy that. and we can make the most of the right-of-way that has been provided to us for that trail. And so with that, I'll miss you all next week. I want to thank you for the opportunity to be able to do this on a weekly basis, and I want to thank you, County Commissioners, for all of the hard work that you're doing also.
Thank you, Representative Weber, and that, of course, goes right back to you also. You know, you've got your hands full. I think you're doing just a terrific job, and we appreciate everything you do for Tillamook County and in Northwest Oregon in total.
Thank you.
Representative
Well, good
Gomberg,
morning,
are you with us this
Thursday.
morning? I know you're there.
I am indeed. Thank you. Good morning, Commissioners. Good morning, Tillamook County. David Gomberg. And as Representative Weber and Senator Anderson indicated, the schedule for the next 5 weeks is going to be a little bit unpredictable. We will each make our best efforts to join you on these Tuesday morning calls as we are able. But we have the formal start to the session at 8 o'clock next Tuesday morning. So we House members are going to be otherwise occupied unless there are some delays. The session is going to be starting up on Tuesday. At this point, the proposed bills have not all been formally introduced, or perhaps I could say formally unveiled, so that you're not able to read all the details yet. But I want to give you a sense of a couple of the larger profile concepts that we understand are moving forward, because each of these has significant consequences to Tillamook County. The first one I wanted to touch on is the governor's proposal for workforce, which is essentially an investment of about $200 million to better prepare Oregonians for better paying jobs. The governor, as you well know, is term limited out. She will not be running for re-election. This will be her last and largest initiative for this session. And one of the aspects, as I understand it, is that the proposal would include $1 million for each of Oregon's community colleges. Now, I will tell you, $1 million is going to go a lot further at Tillamook Bay than it will at Portland State or Portland Community College or Mount Hood Community College. So that's good news for our smaller community colleges up and down the coast. Keep your eye on the governor's workforce bill. There's a lot of things in it, and a lot of things that are going to help people out. Particularly as we train for the jobs that we are going to have here locally that we need to prepare people for. A second proposal, again workforce related, is a proposal to pay overtime to workers in the agricultural sector. Right now, ag workers are exempted from overtime pay. There's going to be a proposal to change that and pay overtime wages to people that work in our forests, our farms, and in our dairy. As you can imagine, this is not only a high-profile measure, excuse me, but a potentially contentious measure. The people that own the farms and pay those wages are concerned. The people that work in the fields and receive those wages are concerned. The people that buy the products that come out of our farms and our dairies are also interested in how this is going to affect their prices. Keep your eye on the ag overtime bill. One aspect that I'm trying to raise the profile of is how this would affect people who are not on hourly wages, but rather on salaries and receiving additional benefits, and how they may be impacted by this change. You know, it's of concern to our dairy farmers in particular in Tillamook County, because they describe themselves not as price makers, but price takers. They are told how much their product will sell for, no matter what their costs are for providing it. So this is going to be a very interesting issue to watch evolve. A third issue coming forward is a proposal by a group of Portland legislators who want to reward essential workers who stayed on the job through the pandemic with a $1,000 bonus check. Now that's very interesting. I've tried to raise the question of what happens to people who could not go to work because the state shut their jobs down in our hotels and in our restaurants and other aspects of the economy, that we've got people that were sent home and therefore would not be eligible for this bonus payment because they stayed on the job through the pandemic. This proposal has about a $300 million price tag. I don't know how far it's going to go. It has a fair amount of momentum, but watch for that proposal. And then finally, I wanted to touch on one other thing of great interest to Tillamook County, and that is the Forestry Accord. You know, in the forest industry, we have been fighting for at least a generation now over forest practices here in Oregon. And finally, the people that were engaged in those debates got tired of fighting with each other and instead sat down and tried to search out common ground, work out some principled compromises, come to an agreement that's going to preserve forest jobs, make sure that the forests continue not only to sustain themselves as a working industry, but also to support our local governments and our schools with tax revenues, but at the same time make some changes that are going to impact our water quality, our stream flows, our runoff, and other consequences of forest practices. That series of compromises is being codified, and I expect to see that move forward in the coming session as well. So those are all big bills in a short session that are going to have an impact on people who live and work in Tillamook County. So I just wanted to give you that projection. We haven't seen all the details yet, but that seems to be the news that we know of today. I wanted to touch on one final thing for you, Commissioners, before I pause for questions. And this is not a legislative issue, but it's an issue of great consequence. The American Red Cross has announced that we are in the midst of a significant blood shortage right now. That blood donations are down about 10%, and as a result of the pandemic, the number of blood drives has declined. They're not collecting blood on campuses as they often do. There's a serious problem, and the result of that, the consequence of that, is that hospitals and doctors are making horrible decisions about who they can treat and who has to wait, what elective surgeries we can provide, how much plasma we've got available in our emergency rooms. I'm urging people to go to redcrossblood.org and get an appointment to give blood. You don't have to go and stand in line and spend the whole day there. You can get an appointment and be in and out. You enter your zip code. It tells you which blood drives are available in your community. I checked this morning. There are 3 of them scheduled in Tillamook in the next 30 days. So I'd encourage people to make an appointment, go down and give blood. You'll feel better, and you'll be making a real difference for folks. I think that's very, very important. So there's a little bit of news about the coming session, and a little bit of news for everybody else that I hope is helpful to our hospital and health network here in Tillamook County. I'm happy to answer any questions that any of you might have.
Thank you, Representative Gomberg. Any questions for Representative Gomberg? Representative, I've got just a couple thoughts, maybe, not questions. It's my understanding that, and I'll put this in your terminology, the unveiling of bills. I understand there might be an unveiling of bills, a large portion of bills coming out maybe today or tomorrow. Can you enlighten us maybe a little on that?
Commissioner, I'm going to plead ignorance on that one. I don't know. I would encourage people to keep checking the Oregon Legislative Information Service, OLIS, for short, and go online and you can see what bills have been introduced, who introduced them, what committees they'll be going to. Certainly there'll be a lot of information coming out in the next few days, but I don't know what the exact beginning of the unveiling process is. As Senator Anderson indicated, each of us is limited to 2 bills during this period. During the long session, we can introduce as many bills as we want to, but and there were in the neighborhood of 3,000 to 5,000 bills. I'm trying to remember what the actual number was. But during the short session, we get 2 bills each. So there's going to be fewer than 200 bills being debated over this period of time. It should be fairly easy to look through them on OLIS and see what's there and what may have an impact on you.
Thank you for that. I do appreciate it very much. One other, just an observation. It's my understanding that the legislature wants to get through this short session very quickly as a short session, and we're not looking to really confront a lot of controversial bills, a lot of bills that are very involved and complicated. And yet you mentioned 4 right here this morning. that are complicated and expensive, and without knowing what else is yet to be unveiled. Just your thoughts. Is that what you're feeling about this session? Is that people really just want to get through this session very quickly?
May I
think
interject?
Please jump right in, Representative.
Okay. We don't have all of the bills listed on OLIS yet because the deadline for listing those is the 26th. And so we can get the full text of the bills on the 26th. And so a lot of the things that are coming to us, we don't have other than if someone provides us with what they have, we don't have the full text on a lot of the bills that are coming forward. And so that's kind of challenging for us when we're going to start delving into these on Tuesday. And it is also very challenging to us when the whole concept of the short session is to deal with tweaks and things that just need to be changed, and it needs to be done rapidly. And to have all of these bills that are going to cause a lot of consternation with some of our members is quite concerning to all of us. So that's my take on it. I'm sorry I interrupted you.
No, not an interruption at all. I appreciate that. Commissioner, you asked whether we're going to be able to get done quickly. And the answer to that is that we have certain deadlines, timeframes, and procedures that limit how quickly we can go. In simple terms, a bill would need to have a hearing in the first chamber the first week, go to the floor of the first chamber the second week. If it passes, it would go to the second chamber for a hearing the third week, and then pass the second chamber the fourth week. And it's difficult to move things any faster than that. So I don't think we're going to have the potential to get out more quickly. But I think really the question you're asking is that I sense that there is a real desire to avoid major drama during the next 35 days. And if we are tackling some issues that seem to be larger than tweaks, it's because the federal government has sent us a bucket of money, and we've got to decide what to do with it. I would rather have the legislature dealing with that even in a short session than turn it over to the emergency board, which is a lot more limited. So those big expensive projects I was talking about are largely dealing with federal money, not our own state tax money. And yeah, they are going to be potentially contentious, and yes, they are large and complicated issues, more so than probably was contemplated when we approved the short legislative session. I don't think we're going to get out more quickly, but I still am hopeful that we're going to be able to avoid drama that we've seen in the past and move smoothly. Keep in mind that in the House, we will have brand new leadership. The Speaker who has served for the last 9 years resigned, and we have designated new leadership, which will be approved, I expect, first thing Tuesday morning, and that would be Dan Rayfield of Corvallis, formerly the chair of the Ways and Means Committee. He should be moving up into the Speaker's position. He will have a little bit different approach to some of the issues than we saw from Speaker Kotek, and I am hopeful that we're going to be able to move forward with a little less drama. Representative Weber, I don't know if you have anything to add to those observations.
No, you're spot on. Let's hope for no drama.
Well, then, all right. So you see a Democrat and a Republican in the House are in complete agreement. So, Senator Anderson, it's completely up to you in the Senate.
Thanks for that challenge. I'll keep the drama out.
So to Senator Anderson and Representative Weber and Representative Gomberg, again, thank you so much for everything you do for the Oregon coast in particular. Guys, you're doing, in my mind, you're doing a great job, and we appreciate that very much. Do we have any other questions for the Coastal Caucus members? Thank you all for being here. Oh, go ahead.
Oh, that's right, Commissioner Yamamoto. It's Commissioner Scar. Just to comment for the listeners, Rachel Armitage will be on KTIL this Friday. So if you were hoping to hear from her, and unfortunately she couldn't join us today, Friday for Tillamook Today, Rachel Armitage will be there. So you can learn a little bit about her before Tuesday's very quick kickoff of the session.
Thank you for that. That's great information, and I would recommend that everyone that has an interest, please tune into Tillamook Today, KTIL, on Friday morning. I think that could be very interesting. I do. Okay, anything else? Let's move on. Tillamook Community Health Center, Marlene Putman.
Good morning, Commissioner Yamamoto. It's Ed Colson with the Health Department here.
Good morning.
Good morning. Well, Tillamook County has a special event announcement. Tillamook County Community Health Center is proud to partner with CARE for the annual Homeless Connect event. So our mobile clinic and staff will be on site to provide medical and dental services this Wednesday, January 26th, from 1 p.m. to 3 p.m. at 904 Main Street in Tillamook. It's just outside of the garage of the former La Tida. So we're excited about partnering for that event. For our COVID-19 county data and updates, our weekend case count is 66, and that was from January 21st through the 23rd. Our 7-day case count from the 16th through the 22nd is 223. And our 14-day case count from the 9th through the 22nd is 412. In total, since January started till the 23rd, we've had 573 cases of COVID-19 in the county. In total, from March 2020 through January 23rd of this year, our total cases of COVID-19 in Tillamook County is 3,000. Our related deaths due to COVID-19 are at 55, and that's unvaccinated at 43, those vaccinated at 11, and those who have no record in the alert vaccination system, 1. Our total COVID-19 related hospitalizations are 121. For our active outbreaks, OHA shows that 5 are reportable, 12 under monitoring, giving us a total of 17. Our 7-day positivity rate from OHA from the 16th through the 22nd is 27%. Our 7-day statewide breakthrough rate from the 9th to the 15th from OHA is 81% of COVID-19 cases were unvaccinated versus 19 were vaccine breakthroughs. As noted with the case data above, we are now in the anticipated Omicron surge. So in order to help reduce strain on our public health and healthcare systems, our public health team, in conjunction with our public health officer, Dr. Melissa Paulison, released the statement last week urging Tillamook County residents to increase awareness of their activities and choose lower risk alternatives, particularly in regard to hosting and attending larger gathering events and activities. It is important that we, as a community, work together to reduce the impact of the surge. We could do that by the following: hosting our event online when we are able, keep gathering small and outdoors when possible. If indoors, bring in fresh air by opening windows and doors if possible. Wear a well-fitting face covering or mask over your mouth and nose when indoors and when outdoors in more crowded areas. Choose to get vaccinated and be up to date on your vaccine, including getting a booster prior to attending events and activities if you're eligible. Continue to wash your hands frequently and avoid touching your eyes, nose, and mouth. Avoid crowds and maintain 6 foot of distance from those not in your household when gathering with individuals who are not yet vaccinated and individuals at a higher risk for COVID-19. And if you are feeling ill, please stay home. In addition to help with the surge, Oregon Health Authority will be providing Tillamook County with a limited number of home test kits for distribution to priority groups who have had difficulty accessing testing. Home test kits are expected to arrive in the next week. The federal site, where each household can request up to 4 COVID-19 home tests to be mailed to their residents at no cost, launched last week. And the website for that is www.covidtests.gov. And while there, you can order your COVID test to be sent to your home. With an increase in people who are testing positive, OHA has updated the process for investigating cases to be an opt-in model, where people who test positive can report their results to OHA and access additional resources for support with their isolation or quarantine using the new OHA Positive COVID Test website. And that's at oregon.gov/positive COVID test. Or they can call the COVID-19 case support hotline at 866-917-8881. If you do have a positive COVID-19 test result and have mild to moderate symptoms such as a fever, shortness of breath, or cough, please contact your healthcare provider right away, and especially if you have chronic medical conditions that may place you at a higher risk of severe disease response. There are safe and early treatment options available for COVID-19, including antiviral oral medication, but these treatment options need to be started as early as 5 days from the date of that positive test. So if you do not have a healthcare provider, you can call Adventist Pharmacy and consider establishing care with a healthcare provider as soon as you can. On our website, tillamookchc.org, you can learn more about the treatment options under the COVID-19 testing and care page. COVID-19 testing does remain available in Tillamook County from our health center at our 8th Street Acute Care Clinic. The hours for that are Monday through Friday, 8 a.m. to 5 p.m. Appointments are required, so please do give us a call at 503-842-3900. And our partners at Adventist Health Urgent Care in Tillamook and at the Reinhardt Clinic also have COVID-19 testing available. Isolation guidance for those who test positive and quarantine guidance is exposed to someone who has COVID-19 have been updated by the CDC and OHA. Those updates, along with downloadable resources for individuals, employers, and workplaces, are available on our website. Once again, that's tillamookchc.org under the COVID-19 testing information page. So for our vaccine update, COVID-19 vaccines remain the best tool to reduce spread and protect you from severe disease from COVID-19, including hospitalizations and death. If you are not yet vaccinated, please choose to make a plan for everyone 5 years and older in your household to be vaccinated as soon as possible. If you are fully vaccinated, please choose to receive a booster as soon as you are able to. People who are eligible for a booster dose include those 18 and older who are 5 months from the completion of the Moderna series, those 12 years old and older who are 5 months from the completion of the Pfizer series, and those 18 and older who are 2 months from their single Johnson & Johnson vaccine, and those who have moderately to severely compromised immune systems who have received the third dose of Moderna and Pfizer at least 6 months ago. In addition, now those aged 5 to 11 who have moderately to severely compromised immune systems are now eligible for a third dose of Pfizer 28 days following that second Pfizer dose that they had. So for our vaccine numbers, for those who have had at least one dose of the COVID-19 vaccine is at 18,407. So in the county, our 16 and older population is at 83.80%. Our 12 and older population is at 79.29%. And our total population who have at least one dose of the COVID-19 vaccine is at 69.38%. And that's as of January 23rd. Those who are fully vaccinated are 16,890. So our 16 and older population is at 76.90%. 12 and older population is at 72.76%. And the total population in Tillamook County who are fully vaccinated is 63.66%, also as of the 23rd. For places to receive the vaccine, the health center has a walk-in vaccine clinic at the Fairgrounds Convention Center, and that is open each Thursday in January from 10 a.m. to 6 p.m. with Pfizer Moderna COVID-19 vaccine available in their first, second, third, and booster doses. We also have the pediatric Pfizer, and we have flu and pneumonia vaccines all available. The vaccines are also available at our main clinic Monday through Friday on Pacific Avenue. Appointments are preferred, so please give us a call at 503-842-3900 to schedule. Then our partners over at Adventist Health in Tillamook, the Plaza Women and Family Health and Occupational Medicine Office, Monday through Thursday, 8 to 5 p.m., and Fridays, 8 to 3, by appointment or walk-in. Pacific City on Thursdays at 8 a.m. to 5 p.m. by appointment or walk-in. And our partners at Adventist Health by appointment, and our local pharmacies at Safeway, Fred Meyer, and Tillamook Pharmacy also have the vaccine available. So with that, that's our COVID-19 update. I'll turn it back over to you, Commissioner Yamamoto.
Ed, thank you for that very detailed report, as always. Do we have any questions for Ed? Thank you again, Ed. Let's move on to the Reinhardt. Oh, excuse me. I'm going to get this right. The Nehalem Bay Health Center and Pharmacy. Gail Nelson.
Yes, good morning.
Good morning.
And thank you. The Nehalem Bay Health Center and Pharmacy, formerly known as Reinhardt Clinic, as you already heard, continues to offer COVID vaccines. We have the first, second, third, and booster doses. They're offered on Tuesdays and Thursdays. We also offer the Pfizer vaccines for children 5 to 11 years old on Fridays. Anyone who is interested can call the clinic for an appointment, 800-368-5182, extension 100. And I'd also like to mention briefly today the Nia County Student Health and Wellness Center. The center opened the fourth quarter of 2021. We are seeing an increased patient load there and also continued community support in the form of donations and grants. And back to COVID, please do not hesitate to call us with any questions or concerns that you may have. If you are experiencing COVID-like symptoms, our staff can be reached at 800-368-5182. And that's my report. I'd like to wish everyone a fabulous day and enjoy the weather.
Thank you so much, Gail, for that report. Let's move on to the Tillamook Family Counseling Center. Do we have Frank Hanna-Williams with us?
Good morning, Commissioners. Can you hear me?
Good morning, Frank.
Good morning. Frank Hanna-Williams, Director, Tillamook Family Counseling Center, Behavioral Health Services for Tillamook County residents. You can reach us for questions about behavioral health concerns, appointments, by calling 503-842-8201. I would like to mention that we are continuing our QPR series. That is a series of meetings and supports around learning the kinds of skills that one may need to know to be able to be a support to a neighbor around concerns related to self-harm. And that QPR series continues, and on Friday, this coming Friday at 10 a.m., we will be doing another in our QPR series. And if you have any interest in that or have some questions about it, please give us a call at 503-842-8201 and ask about the QPR series. Again, that begins on Friday. And in looking at our information, that over the past year and a half, we have primarily the past year, Tillamook Family Counseling Center has been involved in training approximately 100 Tillamook County residents with the skills that QPR brings. So, if you are interested at all, please give us a call. That is my report for today, and I'll take questions if you have any.
Thank you, Frank. I appreciate that very much. Any questions for Frank? Let's move on to the Sheriff's Office. Do we have Sheriff Brown with us this morning?
Good morning, Commissioner Yamamoto. This is Sheriff Brown.
Hey, good morning.
So we don't have anything major to report on. I do want to talk about just a little bit on a couple of subjects. First one is, I'm sure everybody knows, we still have openings within the Sheriff's Office in all divisions. We recently put a new posting up that is specifically for female corrections deputies. As you can imagine, we house females as well as males, and having a female corrections deputy is quite the necessity. So if you know anybody that is interested, we have that opportunity open. I believe it was last week it opened up, and I'm not sure exactly when it closes, but again, we have that opportunity in addition to our normal opportunity. So if you know anybody that's interested, please encourage them to apply. Most of the information that you'll need to know to be able to apply is on the website or through HR. It's something that can be done, and like I said, if you know anybody that's interested or if you yourself are interested, we encourage you to apply. The second thing I'd like to discuss is kind of about our scheduling when it comes to public prints and CHLs. Anybody that's trying to do that will notice that there's some time blocks that are blocked out, or scheduling is kind of up in the air right now in some instances. There's a couple of reasons for that. The first one is we've been very careful about how many we've been scheduling due to the surge of the Omicron variant. So there's a little bit of slowing down, I guess you could say, when it comes to scheduling for that. But one of the bigger reasons for that is we are in the process of upgrading or getting a new website. And hopefully that website will be in place soon. And so our whole system for scheduling and processing through our website is going to change. So we've had to kind of put a stop point on the current system so that when the new system comes into play, we can start scheduling from there. So exactly how that is going to work at this point is not something I can speak to very, very well. I just ask that everybody be patient and know that we are trying to process people as quickly and best that we can, because we want to make sure that those get processed and people are able to obtain those in a reasonable amount of time. So, like I said, just know that we are working on a new website, a new scheduling system, reminder system, etc. So if you're having some difficulty scheduling, that could be a reason why. And again, please be patient and understand that we're going through this change, and we're going to try to get us back up and running as quickly as possible. Other than that, I don't have anything, and I can take questions if needed.
Thank you, Sheriff. Any question for Sheriff Brown? Let's move on to emergency management. Randy Thorpe. Randy, are you with us this morning?
Commissioner Yamamoto, this is Commissioner Scar. He is here in the office, but he's on another call, not this one. So he sends his regrets, but he thought that Gordon would be here and could cover anything that emergency management related.
Thank you, Commissioner. Gordon McCraw, are you with us this morning?
I certainly am. Good morning to everyone.
Good morning.
Beautiful downtown Lebanon, Oregon, where the sun hasn't shone in quite some time, and the temperatures struggle every day to get out of the 30s. Right now it's 32. We have the fog that socks in down here and has stayed. I think I need to come visit the coast again where you're having sunshine, but of course, cool temperatures, and that means that there are some icy spots on the road, so be careful. And it looks like in the long-term weather picture, which has been consuming everything that Tillamook does for the first part of the year, and now it's finally settled down. The long-range models are showing that the cold air will return with some moisture the beginning of February, and the snow levels could be back down to at least the coast range levels. So we're not done yet. And then I looked, just for those that are curious, I did have some questions last week from somebody that was wondering about the snowpack, and the snowpack is obviously doing quite well with most areas in the 90% of what is normal, and many in the 100 plus. So the snowpack continues to look good for basically all of Oregon, with the exception of one small area has snowpack in the 80%, but everybody else is 90 and 100. So hopefully this summer, when it finally gets here, we won't see the issues that we had last year. And like I said, with not much weather going on, I'm taking a break. So unless somebody has any questions, I'll say good day.
Thank you for that, Gordon. Appreciate it very much. Any questions for Gordon? Thank you so much. So we're going to move on to the Board of Commissioners. And Commissioners, I hope you don't mind. So currently I am sitting in a conference room at PUD. I have a 9 o'clock meeting with Tillamook Lightwave, so I'm doing the meeting from here. Hope you don't mind if I start, because I am going to have to be leaving very quickly. No objections. I hope you don't mind. I'll be quick. So on Monday, gosh, that was just yesterday, Rachel Haggerty and I attended the Courthouse Replacement and Task Force meeting This is a combination of AOC, Association of Oregon Counties, and OJD, Oregon Justice Department. Everyone knows that we have some issues with Courtroom 108 within the courthouse in Tillamook County. And we have been trying for years to resolve that problem. We've gone through several iterations, including an $18 million Justice Center, which we couldn't pay half for, and then an over $8 million annex, again, which we couldn't come up with half the money for, various remodel ideas. We currently have a great path forward, rather complicated, and I'm hoping Rachel Haggerty is on the line with us. Maybe Rachel can correct any mistakes that I make here. But we have kind of a three-phase system. So the Board of Commissioners, phase one, Board of Commissioners is going to be exiting our commissioners' meeting rooms A and B, maybe within the next month or so. And commissioners' meeting rooms A and B will become the new the courtroom 108. And we have some remodeling to do, things of that nature. Initially, I think the commissioners are going to be holding our meetings maybe down in the Nehalem room in the basement, somewhere down there, very, very small room. So capacity for visitors is going to be very limited. And of course, we'll let everyone know when that occurs. But there is a backlog of cases that Circuit Court needs to handle and take care of. And because 108 is so small, it's difficult for them to hold all the trials that they need to, especially with dangerous defendants and things of that nature. So we're going to be vacating A and B, and initially going down to the Nehalem room probably, and then we're going to be remodeling courtroom 108 into a boardroom for the commissioners. After that, and this is why we're talking to OJD and AOC, they're currently working on their courthouse replacement and courthouse renovation list. And so Tillamook County, in the 2008 study, Tillamook County had the 4th worst courthouse in the state of Oregon. Well, we've moved from number 4 to number 3. So now we're the 3rd worst courthouse in the state of Oregon. And that's something that we want to remedy. So after we get moved down to courtroom 108 for our meeting room, then we have a plan to build an annex. And instead of doing a courtroom annex like the last, courtrooms are much more expensive to build than just regular meeting space. So we've got two options. We've got the South Lawn, where we originally planned on putting the courtroom annex, or we've got the museum property across the street, and we could kill two birds with one stone there. We could build a 2-story annex, have the commissioners' meeting rooms and offices downstairs, and provide an upstairs where the museum really does need additional space. So there are a lot of options involved here. There's lots of money involved here. That's why we're addressing this with the OJD AOC panel. The legislature always seems to come up with money for courthouse replacements and courthouse renovations. So that's kind of our plan. Once and again, if everything goes according to plan, once the courthouse or commissioner's annex is finished, then we would turn and remodel the courthouse as it stands. There's lots of work that needs to be done, windows and HVAC systems and upgrades for the big earthquakes and things of that nature. So it's a long, involved process. I got to thank Rachel Haggerty for really taking on this project. Our meeting with the Courthouse Replacement Task Force yesterday, I think, went very, very well. So stay tuned. There's just going to be a lot going on here, and some disruption, especially in the commissioners' meeting rooms, as we tend to move around. And until courtroom 108 is remodeled into our meeting room, if we have large meetings, we may be doing those at the library or somewhere else. So please just stay tuned. Other than that, again, we're working diligently on so many other projects, the Linn County class action lawsuit, and the BIOP. I'm going to DC next month, and we have a plan in place to really make sure our legislators in Washington DC understand how bad this is going to be, not only for Tillamook County, but once they roll this out nationwide, it's going to affect a lot of different states severely. So we've got that to look forward to also. So anyway, I just wanted to give that report. I do need to leave and go to the meeting, and so I'm going to turn the rest of this meeting over to Vice Chair Aaron Scar. Aaron.
Thank you, Chair Yamamoto. Enjoy your meeting with Lightwave.
Thank you so much.
You betcha. Thank you for that report. Chair Bell, would you like to go next?
Good morning. Thank you. Well, I was reading about COVID-19, and I came across an article in Science, the journal Science Immunology, that was interesting to me, and I just wanted to share it with the community because it's about immunity, and it's some new findings about what they're calling superimmunity. It says superimmunity is a term used to describe people who are particularly robust against COVID-19, and new research has found there are a couple ways it can emerge within a person. So the findings were built upon lab data from Oregon Health and Science University, which revealed that there's more than one way to become super immune to COVID-19. The two ways are a breakthrough infection after vaccination or a natural infection followed by vaccination. And so I thought this was fascinating. So again, this is in the journal Science Immunology, because people have been talking, we're coming up on 2 years of COVID now about immunity and how do you get immunity, and the idea that if a person gets a natural exposure to the virus and survives it, that they'll have immunity, but then some people are getting sick more than once, and there's immunity provided by the vaccine, but not entirely because we have these breakthrough infections. So it was fascinating to me to read that what they're describing as super immunity is the combination of if you've been vaccinated and you get a breakthrough infection, or if you've had the virus and then you're vaccinated thereafter. So I really just want to encourage people to get the vaccine whether or not you've had the virus, because this may be how we move toward herd immunity. So it struck me as a bright spot in the whole COVID story, which is really quite bleak, with 412 positive cases in the last 2 weeks and a 27% test positivity rate. So I guess the good news there, and those numbers are definitely higher than that actually in reality, because a lot of people are testing at home. And so the good news, as Eric Swanson and Ed Colson both shared, is that we're approaching the height of this surge, and I just want to really encourage people to do whatever you can to keep yourselves safe, and please consider getting vaccinated if you're not yet, and please get the booster if you are vaccinated and you haven't been boosted yet. And I think that's all I have for today. Thank you.
Thank you, Commissioner. Appreciate that. Okay, well, I will try to keep mine brief. I know we're coming up on 9 o'clock. I do want to give a quick update from the Northwest ACT meeting that I attended about 2 weeks ago. Northwest ACT is our transportation committee for our region, and we had the opportunity there to visit with ODOT, and Bill Jablonski, who is the area manager, gave us a quick report on upcoming activities for the year, what we will expect in terms of major projects on our roadways. For Clatsop County, and I'm going to share this because it will impact all of us, Seaside will be having a paving project this coming summer, and it will actually be a 2-year project. So they're going to do their best to make sure that they keep traffic flowing through Seaside by always having at least one lane open and working at night when they can, but it will impact, I'm sure, travel all up and down Highway 101, and perhaps encourage more people to come to Tillamook County if they're trying to avoid that traffic. So just an awareness that in this coming summer there will be major paving in Seaside. For us here in Tillamook County, just an update on Highway 6, milepost 35 on the eastern side where the slide is occurring. They've installed signage and striping, but at this point with the winter weather, the continued rain, the best that they can do is try to maintain, just do the minimum winter maintenance to get through this winter, and then next summer they will take a look at what additional fixing they can do, knowing of course that the major fix that is needed is not yet even on the books or in design phase or anything at this point. So they do know that there's continued slide activity. They do know that the cracks are growing. They're monitoring it. They are doing the best they can to maintain it through these winter months when you really can't get in there for a major fix. He also shared with us that down in Yamhill County, but close to the Tillamook County line on Highway 22, there's a couple of failed culverts that they're beginning design to replace, and that will be 12 months or more out. So those were the big projects that we talked about at Northwest Act. Just wanted to let everybody know kind of what was happening there. Additionally, I have been working with Nan Devlin at Visit Tillamook Coast to follow up on an idea that came out of some of the Safety on 6 meetings that have been held and information that's been sort of kicked around there. And one of them was to try to find a location for a variable message sign that will allow us to put our own safety messaging up. ODOT has very specific, very limited safety messaging that they are able to do as a state agency. So we really felt it would be beneficial if we could have our own variable message sign that was not temporary but was permanent. So Nan Devlin and I are embarking on that work, and just to share with you, it's far more difficult than one would imagine, but we do know about the wheels of government. They turn slowly and the regulations are many. So we are working with ODOT to determine where a sign might be allowable, what permitting might be required, all of those pieces. So just so you know, there is additional work being done locally to try to address some of the safety concerns. I'm going to comment quickly. We had a mid-year budget update meeting last week for the county with the budget committee, just to kind of get a sense of where we were, how things were going for the county. The overall message from our treasurer is that things are going well at this point, that departments are doing a good job of staying within their means, that our biggest challenge is lack of staffing, and that makes it difficult for us to remain on budget. For some departments, that means they will not expend their full budgeted amount. For other departments, it means that money gets used up in overtime because there are departments that simply cannot do without. The sheriff's department being one of those, public works during storm events, that sort of thing being another, where we're using that money up in overtime. The other concern that's on the horizon for the county's budget that we did talk about is timber revenue, and I know we beat this drum regularly, but this year we have a somewhat of a different situation. As many people know, Fallon Logging stopped operations here in Tillamook County and sold their equipment as opposed to selling the company. This has left a shortage of companies here that build roads that make timber harvest possible. So there absolutely is expected that companies will expand and fill that gap, but there may be a limited window of time here where timber revenues are simply slow to arrive to the county because the ability to do those timber harvests is delayed. So that may have some impact on county budget. So just kind of awareness for everyone. It reminds us how dependent we are upon those timber revenues in Tillamook County, how much our property taxes do not cover the services that we are required to offer as a county. So it's an important piece for all of us, and I think you will probably hear more about that if you tune into our budget hearings in April, as we have already asked our county departments, I believe, to start preparing their budgets. We will have the full budget hearings, which are available for folks to listen into if they would like to, and the dates will be put out soon for those, but they are in April. One last thing quickly, I know that there's a lot of conversation in the community about the closing of Nehalem Bay House and Kilchis House, and I just wanted to give a brief update. I spoke with Director Peter Starkey from CARE yesterday, and he just wanted to let folks know that people are being placed from those buildings, working very closely with Senior and Disability Services. They are finding locations for the residents that are there. They are still planning to close those buildings in the middle of February, and they have made no decisions about what will happen with those facilities as of yet. They are looking at all options, which could include other community uses. It could include sale of the buildings. All options are on the table at this time, but no decisions have been made. If you are aware of someone who would be interested in purchasing a building or someone who has a great idea and some funding behind it, Peter would love to talk with you. But there are a lot of just rumors out there about what's happening, and I just want people to take a deep breath and recognize that all work is being done to try to ensure that they remain a really good, strong community asset, whatever that may be. So with that, I am going to stop my report, and we will shift to the cities. So do we have Mayor Mike Scott with us from Manzanita today?
Yes, good morning. I don't really have anything to say. Thanks.
Thank you, Mayor. Appreciate that. Moving on to Nehalem. Do we have City Manager Melissa Kiefer with us today? Okay, not hearing anyone from Nehalem. How about Wheeler? Not hearing anyone from Wheeler. How about Rockaway Beach? Anyone with Rockaway Beach here today? Okay, we'll just keep trucking. Garibaldi, do we have Mayor Tim Hall with us today?
Yes, good morning. However, Garibaldi has nothing to report this week.
All right, thank you.
Enjoy the sun.
Excellent. I think everybody's out enjoying the sunshine. Bay City, Mayor David McCall. Okay, how about Tillamook City Manager Nathan George?
Good morning, Commissioner. This is he.
Anything for us this morning, Nathan?
I do. I'm sorry. I just want to make sure you can hear me okay.
Yes, we can hear you. Thank you.
Excellent. Thank you. Yes, I do. I wanted to report that on Tuesday, January 18th of last week, the City Council voted to uphold the Planning Commission's decision on the Nestucca Ocean Apartments after a citizen's appeal was submitted and held by the Council. The 46-unit housing project is a workforce housing project that will serve our community well. This project and ones like it to follow, especially as we work as a community to provide the infrastructure and opportunities for such development, will yield wonderful benefits to our community in growth, funding, and opportunities. I wanted to add that business is what grows a community. As far as infrastructure, the city has been working over the past year to identify and fix all the inflow and infiltration issues in our city's wastewater collection system. In short, inflow infiltration, also known as I&I, is storm or rainwater that enters the sewer collection system. The city spends an extra $1.4 million a year treating rainwater. Accordingly, as part of this project, the Public Works crews will be doing manhole inspections in Basin 4 this week. And Basin 4 covers everything east of Evergreen Avenue, south of 3rd Street, north of 12th Street, and west of Marloff Loop Road. We ask everyone to please be cautious driving in these areas to protect both our Public Works employees and yourselves. With the stretch of dry weather this week, the Public Works Department will be able to go out and start doing some hot patching of potholes throughout town starting this afternoon, and will continue throughout the week. Please be mindful and careful of the patches. They will be coned off as they need time to dry before the cones can be removed and everyone can drive on them. I do add to, if you see a pothole and you would like to report it, please call the city to report it. We hope in the future to have better ways of reporting, but at least calling or sending an email would be very helpful. You can find the information on our website. On the east side of Stillwell Avenue between 3rd Street and 4th Street in front of Safeway, the sidewalk will be demolished and repoured this week, which will impact the traffic flow in that area. Please avoid this area if possible. If not possible, please be patient and cautious. The city is still taking applications for the police department. We have several law enforcement officer available openings, and the police department is an excellent agency to work for. I personally know that every employee at the TPD He is professional and respectful and very pleased to be part of a great team. The next regular council meeting will be held on Monday, February 7th at 7 p.m. And sometimes the council will hold a work session in the same night. If so, it generally starts at 6 p.m. and is always posted on the agenda the week before the meeting. And as always, the council agendas, as well as other important city documents and news, can be found on the city's website. And the council agendas are also always posted at City Hall at 210 Laurel Avenue. And I just want to say thank you. I hope everyone enjoys the beautiful weather. And thank you again. Thank you, Commissioner.
Absolutely. Thank you, Nathan. We appreciate that. And that is super exciting about the housing development. Glad to hear that that will be moving forward. We know that no matter when we get out and talk to people about what the biggest concern is in our communities, housing always rises to the top. Okay. Yes, thank you. We appreciate City of Tillamook. Last, South County. I imagine that Doug is in that meeting with Commissioner Yamamoto, but let's see if we have anyone else from South County filling in. All right, hearing no one, we will end our meeting. But first, thank you to KTIL for broadcasting and everyone for attending. We will adjourn this meeting at 9:10 a.m. Go out and have a fabulous day.